Hi, I'm Anthony Coxon, President of the Australian Chiropractors Association, and welcome to my April President's Message. These are historic and difficult times. As a practitioner, I feel your pain, as does the ACA board and the ACA staff. Rest assured that the ACA is a member organisation and we are here to support and assist you through this difficult time. You'll know obviously that we're at stage 2 restrictions now. Importantly for chiropractors, we can still practice. We need to obviously be very strict with our hygiene, our social distancing, and also our screening protocols. And I think these have been fairly widely distributed and most people are aware of this. I would strongly advise those who haven't already done so to go onto the Department of Health website and do the infection control module that is available there for COVID-19. You'll never wash your hands the same way again. Regularly wiping down all hard surfaces, so the bench top at your reception desk, the light switches, the door handles, the pens, all these sorts of things. As far as social distancing is concerned, I would suggest you consider taking some of the chairs outside of your reception area, spacing your appointments out so that you never really have more than 1 or 2 people in your reception room at any one time. And that way we can observe the 4 square meter rule. Obviously, there's going to be more of an intimate and close contact when it comes to the actual chiropractor and patient, and we just manage that as best we can. As far as screening protocols, well, obviously the 2-week period of social isolation must take place in anyone who has travelled, anyone who has COVID-19, anyone who's been in contact with someone who's been diagnosed with COVID-19, or anyone who has any cold and flu type symptoms. And this is not only for patients, but obviously for the chiropractors and for staff as well. Now, I want to talk a little bit about immunity. Understand that the research that looks at chiropractic adjustments or spinal manipulation and the effect on the immune system is very thin. And certainly conversations that look at things like potential chiropractic effects on reducing the outbreak of the Spanish flu back in 1918 are completely unprofessional and irresponsible. So we really need to keep the messaging tight here. Yes, we've all had experiences where patients have benefited from chiropractic care beyond just relief of their immediate symptoms. But we've got to be very careful not to extrapolate further than that, because that really then goes against what national law for regulated health professions are all about. Chiropractic does absolute wonders for reducing spinal pain and musculoskeletal pain and disability. We know this from research, we know this from practice, and we shouldn't underplay what a very positive effect that can have in someone's experience of life. They're more likely to exercise more, they're more likely to do the activities of daily living, they're likely to feel less stressed, and all these things have a potential positive roll-on for the immune system function. But saying to see your chiropractor to improve immunity or to in some ways help you with COVID-19 is of course completely erroneous, and we would hope that no one will be doing that whatsoever. Now, the other thing that we're looking at is telehealth, and this is something that's expanding very quickly. Obviously, as chiropractors, we're limited in that most of what we do is with a hands-on experience. But a lot of what chiropractors do that are valuable in terms of a case history, in terms of even potentially making a diagnosis, certainly in terms of exercise prescription or lifestyle changes or reassurance, all of these things can be done over a Zoom conference or over the telephone. So for those that are interested, you can certainly engage with your patients in that way. If you're with Guild Insurance, then they will cover you for a telehealth consultation. If you're with another insurer, then best to check to make sure you have coverage there. Patients will not be able to claim telehealth on their private health insurance, but this is a rapidly evolving area, so please just watch this space. Now, clearly there's lots of you that will be under financial strain at this particular point in time. I would suggest that if you haven't already done so, go to the ACA website on the COVID-19 portal, and there's information about financial services and HR policies there. In terms of understanding what's best to do with your staff, understanding how to take advantages of some of the stimulus packages that the Australian government are putting forward, that's a great resource. Of course, it's also very important that you talk with your accountant. The ACA board meet again next on the 24th of April. I just want to assure you once again that whatever we can do to help, we will be doing, and this will include financial assistance for those who really desperately need it. Now, finally, I want to conclude on somewhat of a positive note. As chiropractors, it's hard to know how much we need to immerse ourselves in this information just to keep up to date, and how much we need to separate ourselves from it so that we're not just overwhelmed with negativity. For most of us, I think there are still things that we can be grateful for, and I would encourage you to make the most of these quieter times. Perhaps look at doing some home maintenance, like painting the indoor side of your house, or maybe trying a different kind of exercise, doing daily yoga, learning a new recipe, or just connecting with your family and children. Another really important thing is to consider how you're going to prepare yourself so when this is all over, your practice is good to go. Because we know one thing for sure, despite all the negativity and the doom and gloom, this too will pass.